Good afternoon, and welcome to NAMI New Jersey's webinar series. My name is Lisa Powell, and I am the Director of Outreach Services and Program Coordinator for ACT Now, the African American Community Together Now at NAMI, New Jersey. Today's topic is caregiving your older loved one during the COVID-19 pandemic. We are honored to have our distinguished speaker, Dale Ofei-Ayisi, joining us today. Dale has over 45 years of postmaster's clinical and administrative experience in medical and behavioral health, social work with patients experiencing a host of end-stage illnesses, including cancer, Alzheimer's disease, heart disease, and neuromuscular diseases. She has direct practice and supervisory expertise in geriatric and dementia care, critical care, rehabilitation, intervention with family caregivers, and as a professional and community health educator since 1975. Dale worked as an outpatient oncology social worker 3 for the Department of Radiation and Oncology and outpatient infusion for the Phillip Citta Regional Cancer Center at Community Medical Center RWJBarnabas Health in Toms River, and has been a recipient of their I Made a Difference Award 3 times. Dale has served for 14 years as coordinator of community services for COPSA Institute for Alzheimer's disease and related disorders. After 45 years of experience, Dale has retired as of January 2020. Dale, we are grateful that you are here, and we're looking forward to your presentation. I will now pass it on to you.
Thank you so much, Lisa. And thank you, audience, for being here today. I want to thank everyone, including the wonderful staff at NAMI New Jersey, for allowing me the pleasure and honor to present this topic to you today. I'm especially honored to be here with the people that I call the unsung heroes and heroines in our country, that is family caregivers, of which I am one. I know that this has been a very difficult time for everyone, but for caregivers, I know that many of the challenges that you've been facing during this pandemic are not unusual for you. So today we're going to talk about in specifically how this pandemic has affected family caregivers. Even though caregivers take care of people with a range of chronic illnesses, I'm going to talk primarily about caregivers of people of older adults with dementia and older adults with a long-term mental illness. Again, because there are some similarities, there are some overlap of some of the concerns that those groups of caregivers do experience. But most importantly, I want to talk today about what you can do not only to help care for your loved one, but also to care for yourself, so that you not only survive, but you thrive during this challenging experience and these challenging realities that we're facing. Throughout our lives, we know that change is inevitable. You've heard some of the old sayings, man plans and God laughs. Life happens when you've made other plans, and the only constant is change. Well, I think I can safely say that none of us experienced or even thought about the type of changes that we've experienced over the past 4 months because of COVID-19. The activities we took for granted, going to work every day, going to school, your loved ones going to their senior center or adult daycare, mall shopping, even keeping up with our non-COVID medical treatment. All of that has been put on hold for what's been an indefinite period of time, even though part of the country is slowly opening. We know that over 100,000 precious lives have been lost. There's been massive unemployment, including the loss of income and the loss of health insurance. And this potentially killer virus is still continuing to strike without abandon. And we don't know when the end will be because we don't have a vaccine at this point. We know that it's been particularly devastating for specific populations of people, people with long-term chronic illnesses, people of color, the poor. But we know especially that older adults have been particularly devastated by COVID-19, especially those living in long-term care residences. The caregiving experience is one that I feel is very complex. We know that that's already, you caregivers out there are very used to living in an environment where you may constantly be in crisis, where your physical, emotional, social, spiritual needs sometimes go unmet. And you have to also balance your care, your work with that of the person that you love and care for. Caregiving can be very rewarding, even though it is, again, one of the hardest jobs that we can do in this lifetime. It's one that can be one of the most meaningful. It allows us a chance to give back to the people that gave to us, be it you're caring for a parent, a grandparent, a spouse, a loving spouse, an adult child, or a sibling. Through caregiving, we can discover strengths that we never thought we had. I worked throughout my career with older adults and found a lot of older adult wives who may have never written a check in their lives, never learned how to drive a car. Because their husband became ill, they had to take over responsibilities that they weren't used to. And some of them even discovered that they did a better job. It fosters relationships. Caregiving is all about relationships, and it can at times strain the best of relationships, but it can also bring people closer together. Not only the person that you love, but the family that's sharing in the care with you. I feel that caregiving is an experience that helps us fully realize our humanity, and show the compassion, which is our empathy in action. Even the smallest of gestures that we make with caregiving, such as kissing away the embarrassment or hurt when someone spoils their bed, laughing and smiling with each other, not at each other, but with each other. All those things, again, help make life worthwhile, especially for that person that you love. It shows the finest parts of ourselves, and it's oftentimes the glue that keeps families together. There's an estimated 43.5 million people go experiencing the job of caregiving. And with the rewards I talked about, there's obviously so many challenges. Constant uncertainty, the experience that most of our fellow Americans are experiencing now, caregivers oftentimes experience on a daily basis, constant upheaval and uncertainty, the physical and emotional exhaustion, the changes in all aspects of our life. Again, as I mentioned, people oftentimes having to choose between their job and their family, which is an awful choice. The constant, sometimes family conflicts over who's going to provide the care. There's an old saying, one mother can take care of 10 children, but 10 children can't take care of one mother. Guilt, which I call the guilt, the gift that keeps on giving, that no matter how much the caregiver does, they feel it's never enough. So caregiving, again, can be one of the most complicated and challenging jobs that we can ever assume. But again, it can be an experience that will give us a lot of rewards, especially tremendous personal growth, depending on how we deal with the experience. So what does this have to do with the COVID-19? It's important, I think, again, since I'm talking about caregivers of older adults, I think it's first important to talk about why COVID-19 has been especially virulent with older people. Research has long shown that social isolation, loneliness, can be deadly literally deadly for seniors, that their life expectancy is much shorter if they're by themselves too much, if there's no mental stimulation, if there's no one checking on whether they're alive or dead. And how many seniors here are living those lives of isolation. Seniors are medically at risk for COVID because they're more likely to live in social situations that might increase their risk. They may share a home with family or multiple family members that are going in and out of the home, and therefore may be carriers of the virus if they don't come down with the virus themselves. Many seniors no longer drive, so they're dependent on public transportation, which, as we've seen in the newspaper, many essential workers who are bus drivers have died because of the coronavirus and having the exposure. Well, the people that are riding those buses are also exposed too. Many seniors depend on ongoing home care assistance, from whom I call those angels of mercy, those home health aides that really are dedicated and that try to provide seniors with quality of life and allowing them to stay in their homes. But those very same people are themselves at risk because they're going into multiple homes. They're working in long-term care settings, which, as we know, they have been particularly devastated by the COVID-19 virus. So many people are forced to discontinue their home care assistance at a time when they may need it the most. I'm going to digress a minute and tell you that, in addition to the years of experience I've had in working with older adults and with family caregivers, I have personally been a family caregiver, and I still am a family caregiver. My mother and I, whom we share a home together, we worked as a team and cared for over 20 years for my grandmother, who had Alzheimer's disease, who died at the age of 102 in her bed at home with both of us by her side. Now I am caregiver for my mom, and she's dealing with a number of different chronic illnesses and needs my help. And so I'll be talking with you from both sides of the desk, so to speak. And one of the experiences we recently had is that my mother had a wonderful, wonderful aide who they just clicked. And unfortunately, she works with a number of other seniors. And so I had to make the difficult decision several months ago to discontinue, her visits with my mom. And hopefully this is a temporary thing. We all three of us, really want her to come back. But that decision that I made was a decision that I know thousands of other caregivers had to make to keep their loved ones safe. Seniors are more likely to suffer from pre-existing conditions that, again, increase that risk. I know you've heard that chronic illnesses like diabetes, kidney disease, cancer, hypertension put you at grave risk for the coronavirus. And then there are those seniors that I mentioned that are living by themselves, who need home care assistance but are not able to get it, and even family members that are available are not able to go into the home and assist them. Caregiving a loved one with Alzheimer's disease is a very, very one of the hardest types of caregiving that there is. We know there's over 5 million Americans that have been diagnosed with Alzheimer's disease, and one of the major risk factors for Alzheimer's is age. The older that you get, the more likely it is that you may develop a dementia such as Alzheimer's or other related dementias. At age 85 and above, I think it is at least 50% of people do go on to develop a dementia. And those of you that are aware of Alzheimer's know that it is a terminal illness, that there is a progressive decline in all aspects of that person's functioning, to the point where they eventually will need 24-hour care, which is usually provided by families or home health aides. And many of those people end up, at least 1 million, end up in long-term care. And the caregiver usually has multiple jobs as a caregiver to someone with dementia, not only personal care, money management, constant advocacy for that person's well-being, is constant coordination with the physicians, with the social service agencies that are providing service, and with family members again. And sometimes those very caregivers that are trying to provide care themselves feel isolated and alone, and family and friends shy away because they don't know what to do or don't know what to say. There is, when COVID-19 strikes either the person with dementia, there are significant difficulties that those patients and their families face. Because of the behavioral issues involved in Alzheimer's and other dementias, certainly the hallmark is memory loss. Your loved one may not remember why they need to wash their hands frequently, why they need to wear a mask, why they can't go up to their neighbor, without a mask and talk with them. So that constantly creates conflicts and many arguments at times when those families, again, trying to help keep that person safe, oftentimes does the very thing that gets that person, more and more agitated. They try to force the issue, and understandably so. If the person ever has to be hospitalized, especially including for COVID, that is another major area of stress, not only for the person, but for the family members caring for them and for the staff. As you know, that often then when people are hospitalized for COVID-19, their families oftentimes are not allowed in, which can be particularly difficult for people caring for a loved one with Alzheimer's. The Alzheimer's patient themselves, is frightened. They don't understand what's happening. They may see people coming towards them all gowned up and be extremely scared and frightened. They don't have anyone that's there that can advocate for them. And let's face it, many healthcare professionals don't understand how to communicate with somebody with dementia, which again further, exacerbates, the entire situation. And then certainly because any type of other illness can cause a more of a decline in the cognitive impairment of the person. So it may put them on a trajectory where their disease further progresses more rapidly than it would have. Avenues providing the dementia management, as I was saying, like home health aides, for example, coming into the home to provide the caregiver with respite, may have to be curtailed or may become unavailable. Adult daycares and senior centers, those places where people can continue to live a meaningful life and their loved one get a break, may be still closed. There are a few I know throughout the state that are open, but again, those services may not be available. Then that caregiver ends up doing triple duty, and both the person doesn't understand why the change, and the caregiver is becoming further stressed, including family members. The other family members that may be there, able or willing to assist, may not be as able to because of the need for the social distancing. So, and one of the biggest concerns that family members have is, what if I get sick? What will my loved one do? Who will take care of them if I track COVID-19? So one of the things that we're going to talk about is the importance of having that plan B, of thinking through and having a plan if the what ifs. What if I do get sick? who can be there to take care of my loved one, and what type of care will they need. We'll be talking about that in a few moments. Even though we know that the CDC guidelines about self-distancing are extremely important to follow, and it's one of the things that they feel has helped to reduce the incidence of COVID-19. Living in a quarantine lifestyle has not been easy for anyone throughout the world. We know that there has been quite a significant increase in mental health professionals have reported that there's been significant increases in emotional illnesses such as anxiety, depression, insomnia, PTSD, substance abuse. Because of this social isolation has been caused by the need to social distance. Someone had coined it as purgatory, as pandemic purgatory. That's had a significant impact on people, and has been especially troubling for families that are caring for someone that has years and years of mental illness, whose depression is suddenly exacerbating and they're becoming suicidal again, whose anxiety is decreased to such a degree, who again is becoming maybe more disruptive and self-destructive in this process at a time when the normal supports that they can depend on may not be there or may be in short supply. We know that for many Americans, many family members, especially older adult parents, have become what we call perpetual parents, where throughout their lives they've cared for an adult child that's had a history of schizophrenia or bipolar disorder. And they've dealt with for years and years the behavior that at times is incomprehensible. These caregivers have had to fight, as I say, on several fronts. They have to fight oftentimes with a loved one who, because of their disease, may openly defy their parents' wishes for them to continue in treatment or take their medication. And to the point where families, again, feel like the very loved one that they're trying to care for hates them. They have to fight with a medical system who, because of that loved one's behavior, tends to neglect mentally ill patients, where research has shown that they have a life expectancy 25 years less of people than people that have never experienced mental illness. Unfortunately, people oftentimes fight with the psychiatric community that doesn't always communicate well with families. And as one family member told me, they oftentimes hide behind the HIPAA laws, so that those families are left with taking a loved one back home who they don't know, what their status is, how they're doing, what the concerns are, and so constantly feel that they don't have that support. And certainly, I don't mean from every member of the psychiatric community. There's wonderful psychiatrists, psychologists, social workers, licensed professionals, counselors who are valiantly helping these patients and their families. These families oftentimes have to fight with a legal system who routinely incarcerates mentally ill patients. They feel that a disproportionately high percentage of people in our jails now are people with mental illness who are not getting the care that they need. As I said, oftentimes the primary caregiver is an older adult parent. And one of the biggest concerns they have is, what will happen to my child when I die, when I leave this world? I remember at one time doing a small seminar for older adult parents of people with mental illness, and originally it was a webinar for older adults on how to deal with your own emotions. And of the 31 people that came, 30 of them were actually there for their adult child. They weren't there for themselves. They were there to figure out, what about housing here in New Jersey? What about treatment? What's going to happen to my loved one when something happens to me? The American Psychological Association has reported that nearly a third of Americans are saying that this current crisis has had a significant impact on their well-being. We've seen an uptick, in addition to the things to the issues that I've mentioned. We've seen an uptick of these oftentimes hidden problems, such as alcohol and drug abuse and domestic violence. And I mention that because I know for a percentage of people, families, the whole issue of domestic violence is one that, again, they're not getting enough help and attention and treatment for. Imagine what it's like to be quarantined with someone who is your abuser, who abuses you or your children. And oftentimes these people have called frantically at some of the domestic violence hotlines, and they are reporting now that these calls are becoming shorter and more frantic because they're so afraid that their perpetrator is going to listen in and hear what they're saying. So imagine what it's like as a family caregiver who may be caring for an older parent in your home whose spouse has lost his or her job and may be becoming increasingly frustrated and depressed and angry and takes it out on you. So one of the things I'm going to share with you as we talk about some solutions, as we look at some resources, are where you can turn to get help if I'm talking to you. Again, we all need to provide support to you, and I'm going to be giving you some resources in a few moments. Some of the issues as far as in terms of the COVID virus related issues that family caregivers of people with mental illness are facing is, again, as I've mentioned, the worsening of their pre-existing conditions, and they may not have access to the therapists that they're used to working with, or the programs that they're used to being involved in. The good news is that there has been a real blossoming of telehealth services, both for physical health and mental health. I'm going to be giving you some resource information on how you can connect to some of the mental health hotlines that maybe can connect you to some of the telehealth services. Some of the therapists that are working with your loved ones may be doing telehealth now, and it's important for you to check that out and make sure where you can access that resource. The good news is that the government has allowed Medicare to doctors that accept Medicare to do telehealth and be paid as if you're doing an office visit. I know my mom and I have participated in 3 telehealth meetings with her doctor, and it's been wonderful. It's been very, very helpful and very supportive to both of us. So don't be afraid to reach out for help to see if there's telehealth services that are available. People with mental illness, oftentimes have lifestyles that may make them at more increased risk. They may be substance abusers. They may have inadequate housing, or maybe living in a shelter where, again, people are living in close quarters that may increase the risk. Their nutrition may be poor. They may not be taking their medication. They, again, may be incarcerated, and we know from the news that the rates of COVID-19 are just burgeoning in our local jails. They may have underlying and undertreated health conditions because of what I had mentioned about the poor medical health follow-up for many people with chronic mental illness. Diabetes, hypertension, obesity, again, which we know from the scientists are high risk factors for COVID. And then the just as in medical centers, psychiatric centers are also facing crises with COVID-19 in their populations, and people that are again in increased risk if they need hospitalization. For both caregivers of people with dementia and people with mental illness, there's a myriad of emotions there's a myriad of emotions in reaction to the isolation and the social distancing and the loss of things that are important to us because of COVID-19. And there's some commonalities in that. Certainly stress is a big one. Who that's going through this has not felt stressed out when they're worried about how am I going to pay my bills if I can't go back if I work at a job where I'm not getting paid while I'm being furloughed. Where even a visit to the supermarket might become dangerous for me or for my loved one. The anxiety, again, this tremendous increase in anxiety and this feeling of total fear, sadness and depression, certainly, the anger and total frustration, feeling overwhelmed, feeling trapped in your home, as many caregivers regularly may feel trapped in their experience as a caregiver, where they can't freely get out and have some alone time, especially if they don't have a lot of support people helping them share the care, so to speak. Most of all, that sense of powerlessness and feeling out of control, which is I think undergirding some of these issues. Some of these feelings that people are experiencing and have experienced as caregivers. Most of all, what I think really undergirds a lot of these feelings is grief. The pain of loss. Certainly the grief over the fact that our lives have turned totally upside down within a very short period of time. But for family caregivers that have been doing this, they've been caregiving over years and years, you know all too well the grief of loss, the loss of the sense of freedom, the loss of the relationship with someone who may not know you or treat you as a stranger now. The grief over as I listen to many of the mental health specialists that are being interviewed on television, most of them are talking about this wave of grief that's gripping the country now as people lose the people that are important to them, the things that are important to their lives. Again, very, very, within a very short period of time, and not knowing when they will ever get them back. Obviously, when someone has died, that's a loss that's permanent. But the loss, the job, the business that you had, all those things that, again, we're not sure whether things will ever, quote unquote, return to normal. The lost time with families, and I think we've seen and experienced in our families those lost milestones, be it a wedding that had been planned or graduation, a high school or college graduation. But people are adapting. One of the most thrilling things that my mom and I recently experienced was that we were invited to a Zoom wedding of a young woman who I remember the night she was born, and she married, she and her fiance married, and there were 80 people at the Zoom wedding, and I got a chance to also see old friends and colleagues that I worked with in California, and it was as if we were there. So people, fortunately, are adapting to these changes in a way that, again, allows us to feel some joy. And we're going to talk about that a little bit too. But in terms of the grieving, the most significant grief is obviously the loss of human life from COVID or incidental to COVID, and not being able to say goodbye, not being able to hold those rituals that we know help us as families begin to accept the loss of someone dear. Right when the coronavirus first began, my family had the loss of our young 42-year-old cousin, and his mom, her only child, and in terms of the funeral, the only people that could come was herself and our cousin's children. And so again, they were forced to grieve alone and not have the community of support around them. For givers especially, there's a special kind of loss that was something that was developed by a researcher, a social work researcher and teacher, Dr. Pauline Boss, and she called that ambiguous loss. It's the loss of someone that as she says, is there and not there. And there's two types of ambiguous losses that, again, I think are very apropos to the caregivers that I'm talking about this afternoon. The type one type of ambiguous loss is when a person is psychologically present but physically absent. And the best example of that is the people that we lost in 9/11. We saw them that morning. They said goodbye to their loved ones and they were never seen again. Or children that are kidnapped, soldiers that are missing in action, even divorce, where you may see that person that, again, you spent what felt like a lifetime with, and now your lives are totally separate. The type 2 type of ambiguous loss is the one that I think most fits with caregivers of loved ones with dementia or with mental illness, where the person is physically present but psychologically absent. I hear many caregivers say, my mother looks like my mother and talks like my mother, but the mother I knew 7 years ago is gone. The caregivers whose loved ones, the relationship changes dramatically because of the cognitive and mental health changes, those people with traumatic brain injury, drug dependency, again, where their behavior, their personality, all of that takes a dramatic change really render those caregivers grief-stricken and experiencing this ambiguous loss. The thing that's unique about ambiguous loss is that the person doesn't know if their loved one will ever return to the person that they once were. One of the people that work with loved ones with mental and family members of those with mental illness say that this is a no casserole illness. And by that she meant that unlike the death of someone and even that's changed now because of COVID, where people bring you casseroles and call you and visit you, sit at, come to the wake or the shiva, or, again, are sending you cards. Dealing with loved ones with these illnesses becomes a very lonely existence where people shy away. I hear so many, over the years and years I've done this, I hear so many caregivers say the most painful thing is that that I feel now that people that were so close to me, they don't even call me anymore. They don't ask how my loved one is. They make an excuse when I see them in the supermarket so they don't spend a lot of time with me. oftentimes it's because people just don't know what to say or what to do. If I had $1 for every time I heard a caregiver say, someone says to me, well, just call me if you need me. Or a family that the caregiver, that when I asked the caregiver, have you told your loved one, some of the challenges you're facing, some of the problems that you're having, their answer to me is they ought to know. This is their mother, this is their father, they should know. Well, no, they don't know. They can't read your mind. They don't know what your needs or concerns are. And one of the things I tell caregivers to make sure you do when someone confronts you like that or says that to you, have something in mind. Okay, next week I need to go to the supermarket for 2 hours. Can you come and sit with my mom? Again, that makes it it's obviously a very difficult thing now in the middle of this COVID epidemic, but this too shall pass. Eventually this pandemic will be over. And so I hope that some of the things I'm talking about today are things that you will take with you and utilize even after this pandemic is over. Those caregivers that are experiencing this ambiguous loss are chronically sad and bereft, and because again they feel so isolated, their grief has literally been frozen. They don't again get the supports that someone whose loved one has passed on, and even now because of COVID, they're not even getting those type of supports because of the need for social isolation. And what I've seen when I worked in my practice is that caregivers sometimes react in two different ways. They're in denial, so that's the caregiver that may take their loved one with dementia from doctor to doctor to doctor until they find a doctor that's saying, oh, there's nothing wrong, this is just old age, or your mom, this is a normal the normal aging process. Or they treat that person as if they're not there anymore. They talk over them and rather than with them to again cope with this awful reality. So what do we do? What options do you have in dealing in coping with this, not only with this pandemic, but also for the future when this pandemic is over? Something someone said on television struck me, and they said, we may not all be in the same boat, but we're in the same storm. You oftentimes may feel totally alone, but in this instant, you are in no way, shape, or form alone. There are many comrades out here that are walking that same walk with you. And the important thing is, how can you make some contact with those people that are struggling with some of these same issues I've talked about? Part of handling not only the pandemic, but caregiving is how we look at things. It's not what happens to you in your life, but how you respond to it, how you deal about it, that'll determine whether it will destroy you or whether it will make you more resilient. We need to take a real honest look at ourselves and say, how do I tend to look at life? How do I tend to look at problems that happen in my life? Is it a glass half full? Do I look at life as a glass half full, or do I look at life as that everything is a melodrama that I'm never going to overcome? Part of what we need to do is again look at how we respond to things. I tell this story about when the pandemic first happened. I had to really challenge my own thinking about things. Is that I live in an adult community, and I would see oftentimes some of my neighbors outside exercising, which was a great thing, but they were all not wearing masks. And so at first, with all of the initial fears about the pandemic, I would look at them and say, look at them out there, they're not wearing masks, and I would see people talking, and when they turn their head towards my home, I would say, look at that. I said, all those, they're talking and those germs are coming out, and it's going to come this way, and my mother and I are going to catch this, and we're going to end up in the hospital. Oh my God. Then I had to stop and say, all right, Dale, Do you wear a mask when you go out? Do you wear gloves when that's necessary? Do you stay in the house and stay home unless you absolutely have to go out? Are you taking other precautions? If you are, calm down. You're doing okay. The only person you can control is you. And so oftentimes part of how we're coping is really challenging our thinking and keeping ourselves from catastrophizing. Again, this is a serious issue, but is something that we need to put in perspective and see what controls we have and what steps we can take. One of the programs when I first became a social worker, I worked in a 28-day alcoholism rehab program, and one of the things I learned the most about it and respected the most are the 12-step programs, be it Alcoholics Anonymous, Overeaters Anonymous, all the anonymous programs, where many of their tenets are not only help people that are struggling with those addictions, but can be a way of life for all of us. They make so much sense. And two of the tenets that I think can be of critical importance and help to caregivers is the serenity prayer and also the belief of taking things one day at a time. The serenity prayer: God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Understanding what of any problems we're facing, what piece of this can I affect, can I change? Whether it's making a change in myself or making a change in the environment, doing things a little differently and understanding that there's some things like those, like whether other people are wearing masks that I don't have control over, but I can make some steps to keep myself safe. The one day at a time. Yesterday's history, tomorrow's a mystery. Today is a gift. That's why they call it the present. Focusing on every day what I can do today. I can't worry about tomorrow. Yesterday's gone. I can't worry about tomorrow. But every day that I wake up is a new day to do things differently, to put things in place that can be very, very helpful to me and to my loved one. The importance of, as I said, of reframing how we look at things can be critical in helping us get through this and any adversity we face in life. I know it sounds counterintuitive, but there are sometimes psychological benefits of dealing with a crisis or dealing with adversity. Many of you may be familiar with that symbol, that Chinese symbol, yin and yang. It looks like two little commas that are on top of each other, and it's usually in black and white. And the Chinese believe that means crisis and opportunity. For every crisis that we face, depending on how we look at it, how we deal with it, there may be an opportunity for change, an opportunity for growth, an opportunity to do things differently. I think one of the most dangerous phrases that we can use in life is, we've always done it that way. Well, this is an opportunity. This oftentimes compels us to do things a little differently that we might find actually is better than what we've been doing. That's been what we thought was tried and true. Anxiety, believe it or not, is as uncomfortable as it is, can be a motivator. It can be the very thing that pushes us into taking some action instead of sitting saying, woe is me, or sitting and stewing about something. It may repel us to try something new. So again, that I don't wish adversity or anxiety on any of you, but I'm saying, look at the silver lining behind that cloud, that there may be something that in the situation that might end up helping you get through this. Many mental health professionals have now been looking at the whole issue of social distancing, or the phrase social distancing, and saying, let's reframe that. Social distancing actually means keeping a physical distance from people. It does not mean that we can't be or should not be socially connected, which is vital for us. And the good news is that during this pandemic, there has been just a rush of different types of social media that helps people stay connected with people that they love. I know that in the final days of people that are dying from COVID-19, some of the wonderful doctors and nurses and staff at the hospitals have been allowing people to see each other using FaceTime, to help those families say goodbye, and that's been a godsend. Using things like our good old telephone, writing letters, that's been a lost art for us, but writing letters or emails to people, Skyping, using Facebook and FaceTime, using Zoom, which we're using right now. Even as I did with one of my neighbors when this first started, we shouted at each other across the street asking how each other was doing. All these things are vital for our well-being, and again, are things that we still have access to. So remember, social distancing does not mean being social disconnection from people. It means, although I may have to stay 6 feet away from you, I can still communicate with you. It is vital for me to communicate, and it is tremendously important for family caregivers. Again, as I said, putting things in perspective, that knowing that as terrible as this period has been, it is like most crises in life, temporary. This too shall pass. That even in the midst of sorrow, we have to find periods where we can laugh with each other, and just understand that we're doing the best that we can with what we know. When I worked at Rutgers, I worked in a program called Ears for Caregivers, and it was a state-funded program through the Middlesex County Department on Aging, where myself and my then colleague Susan Schwartz provided free services, information, education, support groups, advocacy for family caregivers of older adults age 60 and above. And we developed something that we call the 3 Bs of caregiving. We did a lot of community outreach and education to family caregivers. And we talked about the 3 Bs. What are some of the things that will help caregivers cope and enhance their job as a caregiver? It's be educated, be prepared, and be good to yourself. First one, be educated. There's a saying, knowledge is power. Those people that tend to do better as caregivers are the people that learn as much as they can about their loved one's illness, where they become the quasi-experts, where they know what questions to ask that doctor. They know the state-of-the-art treatment. They know what to expect of that disease. They know the medications that their doctor should be considering. All those things, and they know what supports are available in the community to help that loved one and them as family caregivers. This again, we have the gift of time during this pandemic, where we're sitting at home, although I know a lot of people are gradually getting back to work and things are opening up. You may still be at home, and therefore, if you've got your handy dandy computer, you still have time to do a lot of research, using the time that you have to build your knowledge base about COVID-19, about there are some good resources on COVID-19 and dealing with Alzheimer's, COVID-19 and caring for someone with mental illness. Look them up. Learn, get on YouTube can be a wonderful, wonderful resource. There are literally thousands of tutorials on any subject that you want. There are reputable organizations like NAMI, like the Alzheimer's Association. They have their own websites. They have wonderful educational programs on their websites, just as you're participating in today. There are university-sponsored training programs, again, that are no cost or very low cost, and many of these organizations are providing their services free of charge online. Utilize those supports now to get yourself as educated as possible. Family support groups, including the NAMI, I know has through their family programs has support groups online. They can offer not only tremendous education to you, but emotional support, to know that you're not alone in coping with the caregiving process. And again, these groups are available during the pandemic, and my hope is that they will continue. There are telephone support groups that have been in existence even before the pandemic, and I suspect that Zoom will be full of different types of support groups and educational programs like this. The 3 Bs, be prepared. There is something that we used to use in our program we call mobilize to maximize. It's important for caregivers to mobilize all the supports they have around them, be it other family members, neighbors, friends, professionals, resource information, educational information, that help you mobilize all those supports to help you in the caregiving, so that you're maximizing your time and you're utilizing that time not only to take care of the most important elements of your loved one's care as other people may be able to help you with other aspects of the caregiving, but you're also preserving time for you to take care of you. You're preserving your energy. You're maximizing all of the options you have in your toolbox, and most of all, you're preserving your physical and your emotional health. One of the things that caregivers, including myself, have thought about during this pandemic is what will happen if something happens to me, if I develop COVID. I'm the one that's going to the food store or going to other stores. What if I get sick? It is so important to have that plan B. And again, you have the time to do the planning now before you get busy back at work. Think about who are the people that might be available to help me. And that includes professional supports. I've known caregivers who, because family can't or won't be available, other family members, and they have the wherewithal financially, they hire professional geriatric care managers who can be that person that can oversee their loved one's care in the event that they're not there, that they're not available. This is a good time to talk with your family, talk, with people that are close to you, to see what alternate caregivers can temporarily or God forbid, permanently be there for you. And if you set up that type of a plan, it gives you peace of mind to know that things will carry on if you're not there. One of the things I always encourage caregivers to do is developing what I call a care journal. A booklet. It doesn't have to be anything fancy. You can take an old notebook that has the ring binder that you can't pull out the pages, and write down everything you would want somebody to know about your loved one. Everything from the medications that they take, to their favorite foods, to their list of their doctors, the address and the phone number of the doctor's office, of the pharmacy, their meal schedule, all the things that you would want someone else to know in case you couldn't be there. Keep that as you compile it, keep it in the same location, and let a family member, a trusted friend or family, know where it is. If God forbid something happens to you, again, this will give you peace of mind and know that your loved one's care will continue on. Most importantly, being good to yourself. This is not a luxury, it is a necessity for you as a caregiver, not only to be there for your loved one, but when caregiving ends, and for many people, there may be a time when, especially if you're caregiving an older loved one, where caregiving may end. Either that loved one is placed in a nursing home or they pass away, and your life has to go on. What'll happen if you are so burned out physically and emotionally that you end up needing care yourself? So this is a time, and again, with the more time you have now, this is a perfect time to start a campaign to take better care of you. First of all, first and foremost, be, as I say, COVID safe. I know there is a lot of thoughts one way or the other about wearing masks, but remember, it is not necessarily you getting sick. It is that older loved one who you may be bringing the virus home to if you choose not to wear a mask when you go out. Washing hands, for all the things that the CDC tells us. Please, it is critical for both of you to keep yourself as COVID safe as possible. I mentioned about telehealth services. Utilize them. The things that every doctor in the universe tells us to do: getting sleep, eating well, taking your medication, including your blood pressure medicine, taking a walk, even if it's just 10 minutes outside in your yard to get some fresh air and sunshine. Those things may seem mundane, but they're especially important now, so you can be there for your loved one. One of the things that again I found on one of the benefits of things like YouTube is that there's so many tutorials there in learning stress management techniques. If you thought about yoga and never had the time to try it because you've had a busy, demanding job, you've been taking kids to soccer games and all of that, this is your opportunity to spend some quiet time just trying it. If you don't like it, fine, don't do it again. It's time to get reconnected if you've been disconnected from your spiritual life through prayer and meditation. Again, taking those nature walks. Even things like doing what I call diaphragmatic, or what is called diaphragmatic deep breathing. The basic thing when you're feeling anxious is breathing in through your nose, hold, and breathing out through your mouth. Pursing your lips as if you're blowing out a candle. Even that simple exercise can reduce your heart rate and your blood pressure, and again, can make you feel more centered. These, again, are not frivolous things. They're important for your well-being. They said now as if I'm asking you to take on more responsibility. Some people find that having time to play with a pet, taking your pet outside for a walk can be very therapeutic for you as well as important for the pet. Music is one of the things that we find can help people, is one of those things that really helps the brain function well. It can be one of the most relaxing things, and now many of the major organizations, and some of the major symphonies, the Metropolitan Opera, there's so many big organizations that had to cancel their seasons, but now provide free musical programs online. Take advantage of them. Again, you're nourishing your mind and your body by doing this. Take a break from TV. At times I have to take what I call a coronavirus break, where I just turn off the news, and just watch a movie. This is a time to watch an uplifting, or a movie or a comedy. It's okay to escape sometimes. It's necessary for our well-being. Maintaining structure every day is critical. It seems mundane, but it's nothing like getting up, I know that sometimes because people have been so busy on their jobs, they're overwhelmed with caregiving. It just feels so good just to lay in the bed. That's fine. Give yourself that time to do that. But make it a habit to make sure that you have routine every day in your life. Just get up every morning, take a shower, wash up, and get dressed every morning. Set small goals every morning. This morning I'm going to clean out one of my drawers in my dresser. It doesn't have to be a big thing, but it does something to the mind to keep your mind focused. Because when our mind is not focused, what do we do as human beings? We think about the worst. We catastrophize. We think about all the bad things that could happen. But that structure can be very critically important, not only for you, but for the loved one that you're caring for. For especially with people with dementia, routine is very important. That every day is the mirror image of the day before. That if they're taking their medicine at the same time every day, if they're getting up at the same time every day, if they're listening to music at the same time every day, those things help to keep them calm and relaxed, and feel in the moment. And it's good for you too. Don't let your brain and your enthusiasm for life go, as I say, go to pot, go idle and dull. This is a time to, with that little extra time you can eke out, maybe when your loved one's taking a nap, go online and learn something new. It's good for our brains. Expressive arts in particular are good for our brain and good for our overall functioning, and most of all, it allows us to have a little pocket of time where we're creating joy, where we're creating that sense of accomplishment, when we feel like everything is really out of our control. It allows us to feel that sense of control in our lives. Most of all, please don't go it alone. Get some help. There are people out here that are able and willing to help you and support you. There are so many resources that are now online, from the senior centers to and certainly the COVID-19 websites. Many of the organizations I've talked about before have a lot of good information, but it takes, they can't come and get you. You have to reach out and say, I need some help. Know that you're not alone in that. Everybody is struggling with this. Everybody at times is feeling out of control and anxious and overwhelmed and upset and frustrated. You're not alone. However, there are situations that you may find that things are feeling worse than they were before. And there are signals that it may be beyond looking at a website. You may need some professional guidance and support. If you're finding that you are drinking more and more, or taking prescription or other drugs, or smoking more, that you're oversleeping or undersleeping and eating, that you're not responding to attempts for people to reach out to you by phone or by computer, that you're thinking, that you're explosively lashing out, especially at the person that you're caring about, and I mean emotionally or physically, that you are thinking about hurting yourself or them, those are serious signs that you need help as soon as possible. Please don't feel ashamed or afraid to reach out and tell someone that you're so overwhelmed that you can't, that you're afraid that you're not able to handle this anymore. There are people out here that are more than willing to provide that lifeline for you. The next slides are important community resources. Please feel free to avail yourself of these resources. New Jersey for years has had a 211 helpline. All you do is dial 211. They'll ask you what area that you're in, and there's a statewide resources, information of all different types of resources. The area agencies on aging, the ADRC centers or Aging and Disability Resource Connections now have a number of many of those workers. Each county has an office on aging of some type, and now a lot of those workers are working from home. They're still their phone numbers are still being answered. They have websites now that are up and running. Here's the main number to find out where your local area agency on aging is. Many of them, all of them, have some type of resource directory that they put online, so that if you want to know, are there home health agencies in the community that are still sending aids to people's homes, and you desperately need someone to help. Their resource directory may be able to point you in the right direction. The mental health support line and the psychiatric screening services are there to help you if you feel that things are getting out of control for you emotionally. Each county has a psychiatric screening service, many of them located in your local emergency rooms. When you call the emergency room, they will immediately connect you to their psychiatric screening services. This New Jersey mental health support line is available. Organizations like the Alzheimer's New Jersey and the Alzheimer's Association have helplines, and here's the numbers for the helplines. Please don't hesitate to call. They'll talk you and walk you through how to deal with different behaviors. Avail yourself of that. They now, those lines are manned by master's level social workers, many of them, and they are, they're so helpful and supportive. The next slide, as I said, there has been an uptick in domestic violence because of the stresses caused by COVID-19. Then they know, these people that are on these hotlines know that it's maybe difficult for you to talk, so you can text them, and I've given you the text and what numbers to punch in, and they'll know immediately that you need help. There's, as I said, there's online support groups. There are caregiver-focused programs. Care to Caregivers, which is out of Rutgers University Behavioral Health Care, where I worked, has a statewide service funded by the State Office of Aging to help caregivers all over the state, again, walk through some of the issues that you're experiencing and link you up with important services. There are some wonderful caregiver websites that again, you can look at. This caregiver one in particular, the Caregiver Action Network, has wonderful resources. In addition to the resources that NAMI New Jersey has, this Caregiver Action Network has some fantastic resources for people caring for loved ones with mental illness, where they talk about some of the what ifs and how to communicate and advocate for your loved one, and what are some of the issues. How do you deal with the issue of the HIPAA issue? They had some great resource information, and here's their help desk number as well as their website for you. And lastly, there's a wonderful book, Dr. Arthur Kleinman. For 25 plus years, I was a trainer, educator through the programs that I worked, training case managers on different topics related to aging, mental health, and also cultural competence. Dr. Kleinman is a Harvard educated and a Harvard psychiatrist who is an expert in in medical, what's called medical anthropology, understanding the cultural variations and differences in how people deal with illness, how they access help when they're faced with an illness or a disability. But Dr. Kleinman, I discovered, was a family caregiver for his wife, who for 10 years suffered Alzheimer's disease. And this recent book from 2019 was a wonderful, wonderful book. And I encourage you caregivers and professional caregivers to read his book, because he talks about the importance, the fact that in this world now, the needs of caregivers is getting lost, and how important it is for us to support those caregivers, and what his personal experience was as a caregiver. It gave me a whole new, I already respected him as an educator, but it gave me a whole new look and respect for him as a person. I hope these resources were helpful for you, and that you will take them and utilize them as not only during this COVID epidemic, but beyond the epidemic, to not only help your loved one, but also to not only just survive, but thrive as a caregiver. I want to thank you all for your attention, and we certainly will entertain any questions that you have. Thank you so much.
Great presentation, Gail. Thank you so much. We will now be responding to the questions and in the Q&A chat. Okay. First question. Actually, this is a comment. My brother has been in and out of the hospital with various health issues, and this person stated that they knew someone who they could go to talk to his wife for support. That was a comment. Another comment was, thank you for the great information, Dr. Dale. Okay.
I'm not a doctor, but thank you for the comment. Thank you so much for the.
Okay, we do have a question. The question is, will we be provided with the excellent materials discussed by Dr. Dale, Dr. Dale's excellent presentation? And yes, it will be provided. Right. And let's see, another thank you, Dr. Dale, bless you. And I am a caregiver to a caregiver. Let's see, another thank you.
Thank you.
Okay, question. I have a brother that has mental issues and wants to attend a computer school. Please let me know what resources or programs are available.
That's a very good question, because again, it's important for his well-being to have something to work towards. I would start off first with, if he is connected with a therapist, with a program, start talking with the people that again may work, depending on what type of mental illness he's experiencing. I would start off with the experts that are working with them. They may know of specialized programs that he can access, that because mental illness had been considered a disability, whether he may be eligible for some type of specialized programs. I'm not as familiar with any particular programs, but I know that my colleagues in the mental health field very well might, because as part of their role as licensed social workers working in the field, or psychologists or psychiatrists, part of their role should be is, again, helping that person helping them attain their quality or build their quality of life. And that may be making connections to programs out in the community that can help job retrain, things like that. So that's where I would start, is like your local mental health, either the people that may be working with your brother, start off with them, or the local, or NAMI New Jersey, or some of the local mental health associations, to see if they are aware of any specialized programs in the area that he can, after this pandemic is over, that he can link with. But thank you. That's a wonderful thought.
Okay, wonderful. Let's see. And last but not least, thank you, Dale, for an excellent presentation.
Thank you. Thank you all.
Okay. Dale, thank you so much for joining us and sharing with us the valuable information. And thank you so much for your 45 years of experience.
Thank you so much. Thank you. And thank you all out there in the community. Thank you, NAMI New Jersey.
Before we close the webinar, I would like to share with our participants our online resources and information from the NAMI New Jersey website. From our front page, if you go to our Get Involved page, click on Become a Member, you can find out about how to become a member. That being said, all our programs are free. On our front page, you can go to the COVID-19 information page. You will be able to access all our resources and services. You will find where our statewide online support groups are, affiliate support groups, multicultural programs, signature programs, as well as our webinars, like this one, where we will post the recording along with the presentation slides. Feel free to reach out to NAMI New Jersey for any support you might need. Thank you all again for sharing this hour with us today. As a reminder, it would be appreciated if you could complete the survey at the end of this webinar so that we can incorporate your feedback for the future webinars. This concludes our webinar, and thank you all.